Welcome back to Biology 5, and today we are going to be talking about the overview of the skeletal system. Learning outcomes are state the functions of the skeletal system, describe the structure of a long bone and list the types of tissue it contains, list the 3 types of cartilage found in the body, and provide function for each. The skeletal system is comprised of bones and ligaments that work together with the muscular system to protect the body and provide support for locomotion and movement. Bone and cartilage are found at joints, whereas ligaments are found at the bones. The function of the skeletal system involves the framework of the body. It functions as support, movement, protection, production of blood and cells, and storage of minerals and fats. The shaft of the long bone is also known as diaphysis. It has large medullary cavity, whose walls are comprised of compact bone. The expanded region at the end of a long bone is called the epiphysis. The epiphyses are composed largely of spongy bone that contains red bone marrow, and a long bone is covered by an outer layer called the perisosteum. Over here you can see an outer film called the perisosteum. You can see the epiphysis, and then the diaphysis. The metaphysis is between the epiphysis and diaphysis, and it contains the epiphyseal plate, a region of cartilage that allows the bone to grow. As mentioned, the perisosteum is the connective tissue that covers all the bones, continuous with the ligaments and tendons. Bone. Compact bone is made up of osteons, whose bone cells are also known as osteocytes. Osteocytes are mature bone cells located within the lacuna of a bone. The lacuna are small pits or open cavities where the cells are located. Matrix fills the space between the rows of the lacuna. Here's a picture showing you the osteon. We have the central canal where the blood vessels are formed, and then a series of osteocytes surrounding the lacuna. One osteocyte is one bone cell. You can see the spongy bone on the left and the perisosteum on the right. Canaliculi are tiny canals that run through the matrix that connect the lacuna with another, and with the central canal. Osteocytes stay in contact with each other inside the canaliculi. They allow exchange of nutrients and waste through the gap junctions and connect adjacent osteocytes. Spongy bone is porous bone found at the ends of long bones, where the red marrow is located. Red bone marrow produces all types of blood cells. Spongy bone contains thin plates called the trabeculae that follow lines of stress, making it strong. Cartilage. Cartilage is a connective tissue whose matrix is gel-like and contains collagenous and elastic fibers. Cartilage is a lot more flexible, but is not as strong as compared to bone. It contains no nerves, no blood vessels, and makes healing extremely slow. Cells that are found within the lacuna of cartilage are called chondrocytes, and there are 3 types of cartilage: hyaline cartilage, fibrocartilage, and elastic cartilage. Hyaline cartilage has matrix made of collagen and is found at the ends of long bones and ribs, in the nose, the larynx, and the trachea. Fibrocartilage has thick rows of collagen fibers and is able to tolerate pressure and tension. These are found in the disc between the vertebrae and the cartilage of the knee. Elastic cartilage is found inside the ear flaps and epiglottis. Fibrous connective tissue. Fibrous connective tissue is composed of cells called fibroblasts, separated by closely packed collagenous fibers and found in the tendon and ligaments. Ligaments connect bone to bone. Tendons connect muscle to bone. The next submodule is bones of the axial skeleton. Learning outcomes are: identify the bones of the skull, hyoid, vertebral column, and rib cage. Identify the regions of the vertebral column. Explain the functions of the sinuses and intervertebral discs. There's 206 bones in the skeletal system, and they're classified as either axial or appendicular. Axial skeleton refers to the midline of the body, and it consists of the skull, the hyoid bone, vertebral column, and the rib cage. Here's a picture showing you the axial skeleton versus the appendicular skeleton. The skull is formed by cranium and the facial bones. The cranium protects the brain and is made out of 8 bones that are tightly fit together. The major bones of the cranium are the frontal, parietal, occipital, temporal, sphenoid, and ethmoid bone. In newborns, the cranial bones are joined by membranous, softer bone-like structure called fontanelles. These usually close by the age of 16 months. The foramen magnum is a hole in the occipital bone by which the spinal cord can pass through. The external auditory canal is inside the temporal bone and leads into the middle ear. The sphenoid completes the sides of the skull and contributes to forming the orbits, the eye sockets. And the ethmoid bone helps form the orbits and also the nasal septum. Here's a lateral view of the skull that's color-coded. Here's a frontal view of the skull. You can see the frontal bone, temporal bone, nasal bone, zygomatic bone, maxilla, upper jaw, and the mandible, lower jaw. The sinuses are found inside the cranium. These are air spaces in some of these cranial bones. They are lined with mucous membrane. They help reduce the weight of the skull, and they give a resonant sound to the voice. And these are named according to the bones by which they're located: the frontal, sphenoid, ethmoid, maxillary. And the smaller set of sinuses are called the mastoid sinus, which drain into the middle ear. Mastoiditis is inflammation of these sinuses. The facial bones consist of the mandible, lower jaw, maxilla, upper jaw, zygomatic bone, and nasal bones. The mandible is the only movable bone in the skull. The maxilla forms the upper jaw and a portion of the orbits. The hard palate and the floor of the nose are formed by the maxilla joined together with the palatine bones. The zygomatic bones are your cheekbones. The nasal bones also form the bridge of the nose. Other bones, like the ethmoid and vomer, are part of the nasal septum, which divides the interior of the nose into 2 nasal cavities. The lacrimal bone is the opening for nasal lacrimal canal, where the tears drain from the eyes to the nose. The hyoid bone. The hyoid bone is located superior to the larynx, where it anchors the tongue and serves as a point of attachment for muscles used in swallowing. The hyoid bone is the only bone in the body that does not articulate with any other bone. The hyoid bone is not part of the skull because it is part of the axial skeleton. In cases of suspicious death, a fractured hyoid is a strong indication of manual strangulation. Here is a picture of the hyoid bone that sits above the trachea. The vertebral column is a series of 33 joined vertebrae that extends from the skull to the pelvis. The vertebral column supports the head, the trunk, and protects the spinal cord and nerves, and is also a site for muscle attachment. Each vertebrae has a facet that articulates with each other, and a spinous process that projects backwards towards the back. Scoliosis is an abnormal sideways curvature of the spine. Kyphosis is an abnormal posterior curvature, a hunchback appearance, and lordosis is a swayback, where you have the abnormal anterior curvature to the vertebral column. The vertebral canal is the center of the column, and the spinal cord passes right through it. Intervertebral foramen is on each side of the column, and this is where spinal nerves are able to travel through. The spinal nerves control the skeletal muscle contraction, and among other things, and if the spinal cord or spinal nerves are injured, there can be paralysis or even death. The spinous process is a bony projection along the midline of the back, and the transverse processes extend out laterally, and both the spinous and transverse processes serve as an attachment for muscles. Types of vertebrae. Cervical vertebrae, 7 of them, are in the neck and include the atlas and axis. The atlas holds up the head and allows the head to tilt side to side. The axis allows for rotation. Axis is the second vertebrae and allows you to shake your head. Here's a picture of the 33 pieces of vertebrae. The 7 on top are the cervical, the 12 are the thoracic, the 5 are the lumbar, and the sacrum are the fused 5 vertebrae. Here is a general anatomy of a vertebrae: a body, the vertebral column, the spinous process, articular facets, the transverse facets, intervertebral discs. Intervertebral discs are made up of fibro cartilage, providing padding between vertebrae. The discs prevent the vertebrae from grinding against each other, and so they also serve as a shock absorber. These discs become weak with age and can herniate and even rupture. The rib cage. The rib cage is a thoracic cage comprised of thoracic vertebrae, the ribs, and their cartilages, and the sternum. The rib cage is part of the axial skeleton and protects the hearts and lung. It swings outward and upward for inspiration when you breathe in, and downward and inward upon expiration, breathing out. Here's a picture of the rib cage. You can see the 12 pairs of ribs. The last 2 are considered floating ribs. The first to 7 are true ribs, and 8 to 12 are considered false ribs. The ribs are flattened bone that connect to the thoracic vertebrae. The upper 7 pairs connect directly to the sternum via the costal cartilage. These 7 are called true ribs. Ribs 8 through 12 are called false ribs because the costal cartilages at the end of the ribs do not directly attach to the sternum. The sternum, the breastbone, lies in the midline of the body and protects the heart and lungs. It is made of the manubrium, the chest plate, the body, and the xiphoid process. The manubrium articulates with the clavicles, the collarbones, and the manubrium joins with the body of the sternum at the angle. Counting the ribs is sometimes done to determine where the apex of the heart is located, and this usually is between the 5th and 6th ribs. The xiphoid process serves as an attachment for the diaphragm, which separates the thoracic cavity and the abdominal cavity. Bones of the appendicular skeleton. Learning outcomes are: identify the bones of the pelvic and pectoral girdles, identify the bones of the upper and lower limbs. The pectoral girdle and upper limb. The body consists of the left and right pectoral girdles. Each side is comprised of a scapula, the shoulder blade, and a clavicle, a collarbone. The clavicle joins with the sternum in the acromion process of the scapula. The muscles of the arm and chest attach to the coracal process of the scapula. The glenoid cavity of the scapula articulates with the head of the humerus, or the upper arm bone, and that forms your shoulder socket. Here's a picture showing you the clavicle, the glenoid cavity, the scapula, the humerus, the radius, and the ulnar. You can also notice the elbow joint, the trochlea, and the capitulum, linking in with the head of the radius and the ulnar. The pectoral girdle is a joint that's very mobile, but also very unstable. It can dislocate. Ligaments and tendons stabilize this. The rotator cuff are tendons that extend to the humerus from the small four muscles originating on scapula, also known as the rotator cuff muscles. Vigorous circular-based motion can cause the arm and the rotator cuff to be injured. The radius and the ulnar make up the forearm. The humerus, the single long bone in the arm, has a smooth, rounded head that fits into the glenoid cavity of the scapula. The shaft of the humerus has a tuberosity, a protuberance or extension, where the deltoid muscles and the shoulder muscles are able to attach to. The far end of the humerus has 2 protuberances called the capitulum and the trochlea, which articulate and form a joint respectively with the radius and the ulnar at the elbow. The bump at the back of the elbow is also known as the cranion process of the ulna. The hand is made up of 8 carpal bones, 5 metacarpals, and phalanges of the fingers and thumb. The metacarpals are in the palm, the carpal bones are in the wrist, and the phalanges are the fingers and thumb. The pelvic girdle and the lower limb. The pelvic girdle, or the hip girdle, consists of 2 coxal bones, the hip bones. The pelvis is composed of the pelvic girdle, the sacrum, and the coccyx. It bears the weight of the body, protects the organs within the pelvic cavity, and is a place for the attachment for the legs. Here's a picture showing you the hip bone, the ilium, pubis, and ischium. We have the head of the femur sitting into the hip socket, the femur, the patella, the kneecap, the tibia, the fibula, and then the tarsal bones. Each coxal bone has 3 parts, the ilium, ischium, and the pubis, which are fused in the adult. The hip socket is also known as the acetabulum, where all of these 3 bones meet. The ilium is the largest part. We sit on the ischium, which contains a posterior spine called the ischial spine, and this is where muscles can attach to. And there are 2 pubic bones that are joined via a fibrocartilaginous joint called pubic symphysis. The male pelvis is slightly different than the female pelvis, in that the female has the iliac bones that are more flared, and the pelvic cavity is a little bit more shallow. And also the inlet is wider. This helps with facilitating birthing process. The lower limb consists of the femur and the thigh, and the tibia and the fibula in the lower leg. The femur is the longest, strongest bone in the body. The head of the femur articulates with the coxal bone at the acetabulum. The neck better positions for the legs for walking. And the femur has 2 large processes, the greater and lesser trochanters, which are places for attachment for the thigh muscles, the butt muscles, and the hip flexors. At the distal end of the femur is the medial and lateral condyles that form a joint with the kneecap and the tibia. The patella is the kneecap, held in place by the quadricep tendon, which continues as a ligament that attaches to the tibial tuberosity. At the distal end of the tibia, you have the medial malleolus, the medial ankle, and in the fibula, the slender bone of the leg, we have the lateral malleolus, which forms the outer bulge of the ankle. Tarsal bones are the 7 bones of the ankle. The talus joins the fibula and the tibia. The calcaneus is the heel bone, and the talus and calcaneus support the body's weight when you're squatting. Metatarsal bones are the 5 bones in the intercept, and the phalanges are the bones of the toes. Identifying skeletal remains. Age is approximated through dentition and studying areas of the bone ossification and joint conditions. For gender, it is best to use a pelvic bone, but the thickness of the bones or skull characteristics may also be used. Ethnicity is difficult to tell, but skull characteristics are very, very useful. The next sub-module is articulations. Learning outcomes are: list the 3 types of joints, describe the structure and operation of a synovial joint, summarize the types of movement made possible by a synovial joint. Articulation is a term for bones joined at joints. Articulation is classified as fibrous, cartilaginous, and synovial. Fibrous joints are immovable, cartilaginous joints are connected by hyaline cartilage and tend to be slightly movable, and synovial joints are freely movable. In a synovial joint, the fibrous capsule is lined with a synovial membrane, which secretes the synovial fluid to lubricate the joint. Fluid-filled sacs called the bursa reduce friction, and the menisci are C-shaped fibrocartilage that give stability and absorb shock. Here are pictures of synovial joint. We have a generalized synovial joint on top, a ball socket joint like your humerus to the scapula, and then the hinge joint like the elbow. A ball socket joint allows movement in all planes, even rotational movement, that is a hips and shoulder joint. Hinge joint permit motion in only one direction, like your elbow and knee joint. Here's a picture of the synovial joints that allow for a variety of motion. Flexion, joint angle decreases. Extension, joint angle increases. Adduction, where the body parts move towards the midline. Abduction, body parts move away from the midline. Supination, where the hand faces interior or downward. Pronation, where the hand faces posterior and downward. Circumduction, eversion, and inversion. Osteoarthritis is a degeneration of the articular cartilage inside joints. Rheumatoid arthritis is an autoimmune disorder that causes inflammation and swelling and pain inside the joints. The next submodule is bone growth and homeostasis. Learning outcomes are: summarize the process of ossification and list the types of cells involved, describe the process of bone remodeling, explain the steps in bone repair. The skeletal system starts to form in 6 weeks in the embryo. Bones grow in length and width through adolescence. Bones are living tissue. Bones have the ability to grow, remodel, and undergo repair. Osteocytes are mature bone cells that arise from osteoblasts. These are bone-forming cells. Osteoblasts secrete the organic matrix of a bone and promote the deposition of calcium salts into the matrix. And as they mature and calcify, they become osteocytes. Osteoclasts are bone-absorbing cells. Throughout the life, osteoclasts are removing the matrix of the bone, and osteoblasts are building it up. Ossification refers to the formation of bone classified as intramembranous or echondral ossification. Intramembranous ossification occurs between flat sheets of connective tissue in a process where connective tissue cells become osteoblasts. They then secrete organic matrix of the bone that contain different kinds of polysaccharides and collagen fibrils. The osteoblasts promote ossification by adding calcium salts, resulting them to form the trabecula of the spongy bone. The trabecula is then used to fuse and become compact bone that surrounds the spongy bone. Echondral ossification: most bones of the human skeleton are formed by this way, in which hyaline cartilage models of bone are filled in with bone. The steps of echondral ossification include the cartilage model, the bone collar, the ossification center, the medullary cavity, and the secondary ossification sites, and the epiphyseal growth plate. It starts with a cartilaginous model developing and becoming calcified during fetal development. Then as new derived osteoblasts cover diaphysis, they form the first bone collar. Blood vessels begin to provide nourishment to the area. The medullary cavity then forms compact bone collar that thickens, and a secondary ossification center appears in the epiphysis. The cartilage model states that in the embryo, hyaline cartilage shaped like in future bones. The bone collar, which are osteoblasts that secrete matrix, which will then calcify. This will then result in a collar of compact bone. The primary ossification center is where blood vessels begin to nourish the osteoblast in a region called the primary ossification center, where is the first center of bone formation. The medullary cavity and the secondary ossification center, the spongy bone in the diaphysis, is absorbed by the osteoclast, which then form the medullary cavity. Shortly after birth, the secondary ossification center forms in the epiphysis. The epiphyseal growth plate is a band of cartilage that remains between the primary center and the secondary center. As the limbs keep growing in length, so do these epiphyseal plates, and they are present. Cartilage is now in two locations: the epiphyseal growth plate and the articular cartilage, which covers the ends of long bones. The epiphyseal plate contains 4 distinct layers. The layer nearest to the epiphysis is called the resting zone, where cartilage remains. The next layer is a proliferating zone, in which chondrocytes are producing new cartilage cells. The third layer is called the generating zone, in which the cartilage cells are dying off. And the fourth layer is called the ossification zone, where the bone is forming and increases the length of the bone. You can see on this picture, zooming into the epiphyseal plate, that we have the epiphysis on top, resting zone, proliferating zone, degenerating zone, and the ossification zone. This happens in that growth plate. Final sizes of the bone. When the epiphyseal plate closes, bone can no longer increase in length. In women, this happens in about ages 16 to 18, and in men at about age 20. Several hormones play an important role in bone growth: vitamin D, growth hormone, thyroid hormone, and sex hormone.